Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Hello, I'm Annie Rogers here to welcome you to Attitude Magazine's ADHD Experts broadcast today. We're extremely pleased to welcome Dr. Joel Nigg, one of the world's preeminent experts on ADHD, to lead today's webinar titled, You're So Emotional, Why ADHD Brains Wrestle with Emotional Regulation. And based on the overwhelming number of you who have registered for today's webinar, it's safe to say that this topic of emotional dysregulation in ADHD brains is of huge interest and importance. Before we get started, I wanted to just note a couple of housekeeping items. Those of you who tuned in to the live webinar may download the slides now by clicking on the Event Resources section of your webinar screen. And if you're interested, the Certificate of Attendance option, look for instructions in the email. You will receive that about 45 minutes after the live broadcast ends. For those of you listening in replay or podcast mode, please visit the webinar replay page on the Attitude website. It's attitudemag.com/webinar/emotional-regulation-ADHD-anger management. Anger-management for access to both the accompanying slides and the certificate of attendance option. So with that said, I will introduce today's expert. Joel Nigg, Ph.D. He is a clinical psychologist and professor and vice chair for psychology and director of the Center for ADHD Research at Oregon Health and Science University. Dr. Nigg is the author of Getting Ahead of ADHD, What Next Generation Science Says About Treatments That Work and How You Can Make Them Work for Your Child. He and his research teams have published more than 200 peer-reviewed scientific papers related to the neuropsychological, cognitive, and temperamental correlates of child ADHD, to ADHD genetics, and to brain-based research in ADHD in children, adolescents, and adults. We're so excited to have him. And before I turn over the microphone, I wanted to thank the sponsor for today's webinar, Play Attention. Are you homeschooling this fall? Whether you're planning full-time homeschool or hybrid homeschool, Play Attention can provide the right tools for success. Our customized neurocognitive training plans improve executive function and self-regulation. Join our webinar and learn how we can help you with your homeschool roadmap and improve executive function. 800-788-6786 or www.playattention.com. Attitude thanks our sponsors for supporting our webinars. Sponsorship has no influence on speaker selection or webinar content. So with that said, I would love to turn over today's presentation to Dr. Nigg. Thank you so much for being here, and we listen attentively to this presentation.
Thank you, and hi, everybody. Welcome, and I see questions already coming in, so I will definitely leave sufficient time at the end for several questions to be addressed. But I wanted to cover a number of topics today to orient this area that is both of great interest, I know, to lots of people involved with ADHD and also a hot topic in the scientific community. ADHD, as most of you probably know, is supposed to be inattention, disorganization, unable to focus, one's attention being either overfocused or underfocused, being hyperactive, on the go, fidgety or restless, being impulsive. But there's a bit of an elephant in the room, which is that the main complaints often for adults with ADHD, when they talk to me about what's bothering them, or parents talking about their children, is things like he can't control his or her emotions, can't control anger, out of control temper tantrums, overreacting, oversensitive, and so on. Or as the title said, way too emotional. So this seems to be part of the ADHD experience. And in fact, a long time ago, in the middle of the 20th century, before we had ADHD, we had minimal brain dysfunction. And if you go back and actually look at the criteria for minimal brain dysfunction at that time, they included this feature. So it really was separated out from ADHD in the official nomenclature, but it's never been separated out in the personal and clinical experience. Partly this is because ADHD doesn't happen alone. Most people, the majority, before they at least reach adulthood, have a second condition, often a mood problem, anxiety or depression, as well as other neurodevelopmental problems here. So part of the reason for this overlap is sometimes there is an actual anxiety or depression or other mood disorder accompanying the ADHD. But that's not the whole story, and often is not the story. People with ADHD have problems with anger and anger regulation and tantrums, even when they don't have an anxiety or depression or other disorder. Why is this? This is partly also because self-regulation, the actual core of ADHD, involves the whole person. We don't self-regulate only in our thoughts, only in our emotions, only our actions. We regulate our emotions, thoughts, and actions in unison. This is an interplay dynamic in our lived experience moment to moment. What we think, what we feel, and what we do are all closely tied together. And so we have a thought that leads to a feeling, or a feeling that leads to a thought. We take an action, or we do a behavior, a thought or a feeling results. Those intersect each other. So separating out attention from emotion, while we can do it on a piece of paper, it's really hard to do in daily experience. So part of this is the nature of self-regulation. And if we think of ADHD, and I've done whole webinars on this, as really about self-regulation across emotion, behavior, and attention, then it makes sense as opposed to simply a disorder of attention. In fact, ADHD is emotionality and emotional struggles is one of the big reasons that ADHD poses such a high risk for the subsequent onset of other problems. Here you can see the actual kind of 2-scale rate and timing of onset in childhood of anxiety disorders, mood disorders, and substance use disorders subsequent on ADHD. As this goes forward, of course, the ADHD continues forward, even though the bell curve shows that onset tapers off. So there's a close relationship, both at the clinical level in terms of future risk, often, especially for adults, co-occurring, but also in terms of the general role of self-regulation for why emotional regulation issues overlap with ADHD phenomenologically or in our experience. I want to pause here to introduce a number of terms that you probably have seen or will see as you read and learn about this that all kind of overlap here. Irritability is a common term here. That just is another word for tantrums, anger dysregulation problems. But it also includes, for many people, a kind of grouchy, negative feeling toward things, even when they're not having a tantrum. And so we separate out the experience for some people of being kind of grouchy and negative, and then occasionally exploding in a tantrum of anger, from those who don't seem to be grouchy or negative, but still explode in angry tantrums, and both can occur. The term lability comes up. That just means that moods are really reactive, really changeable. You might be really up on top of the world at one point and then in tears the next, depending on some mood that happened. This is something that is readily seen in children with ADHD, but it's also an experience often internal rather than external, but also external for adults with ADHD. Recognition means, can you actually recognize and notice other people's emotions? For people with ADHD, usually you can if it's pointed out to you, but sometimes for people with ADHD, they don't notice other people's emotions until it is pointed out. Affective intensity is the felt intensity, and people with ADHD tend to feel their feelings very intensely. And then dysregulation is what we talk about as the difficulty regulating one's emotional intensity to what's appropriate to our goal or our situation that we're in, whether a child or adult. This can certainly include anger and tantrums, but it also includes other emotions as well. Now, it's also another critical definitional side note is this idea of disruptive mood dysregulation disorder. This is a new disorder in DSM-5 that parents, those of you that are parents in the audience have probably heard or may have heard if your child has severe tantrums. And it's important that you understand this element. The reason we have this is that there was a crisis in child mental health in the 90s. And that crisis was an explosion of apparent manic depressive disorder or bipolar disorder. This chart just shows that for adults, the rate of bipolar disorder diagnoses increased a little bit between the 1980s and 90s and early 2000s. But for children, it went up 100-fold. And this really threatened the credibility of the entire field of child psychiatry. So the perception among the leadership in the DSM committees was that something had to be done about this. And this just shows the concern here. You can see in this particular instance a 10-fold increase, although some data go even higher than this. And the problem was that young children were given these serious mood stabilizing drugs, antipsychotics, lithium, multiple medications in a majority of the cases, very dangerous medications for young children on the theory that they had kind of latent manic depressive disorder. This turned out not to be correct. True bipolar disorder has the features that are listed here, and it's extraordinarily rare in pre-adolescent children. It has to include a true mania, a true episode of grandiosity, elevation of mood outside of baseline, not just irritability. And the error was the thinking that irritability could substitute for mania in children. And this became a widespread belief that was promoted in professional circles in the 90s and really led to this false epidemic and mistreatment of children. DMDD was therefore created to plug this gap, to have a place for clinicians to, quote unquote, put children with severe chronic temper tantrums who we now know did not have elevated risk for bipolar disorder in their family or in their future from longitudinal studies, and to enable new research to look at how to best intervene to help children with severe temper tantrums. And this also applies to adolescents and adults. There's two main features here, as I already mentioned. One is the severe tantrums that are grossly out of proportion. And this can include behavioral aggression, or it can just include verbal tantrum. And then this baseline grumpy mood that, if absent, you usually just have aggressive tantrums. And there's another condition called intermittent explosive disorder that sometimes is applied here. This does not apply to preschoolers. So those of you worrying about your preschoolers is a separate discussion. It's important to recognize that in reality, most of the people who would meet criteria for this syndrome just really have severe ADHD, sometimes with an anxiety disorder or an oppositional defiant disorder. But they are given this diagnosis to help avoid the bipolar diagnosis they were getting before. Now, the reality is that if you have ADHD and problems with anger or tantrums, whether you're a child or an adult, you're not alone. This is the majority of adults with ADHD that report this problem. And this has been reported in the literature for a long time, since 1995, even though it's been often neglected. And in children, we've done our own research on profiles of children for anger dysregulation and emotion dysregulation. And we see that some type of emotional dysregulation, whether around excessive sensation seeking and excessive excitement that leads to excessive impulsivity, or anger and tantrums, this is the majority of the children with ADHD as well. When we look at this at the level of traits, personality traits, we can see the ADHD symptoms have a strong overlap as well with irritability and anger. In fact, irritability and anger, this is not proportion of people. This is just variation on a statistical trait. You can see here that the biggest trait that overlaps with ADHD is actually anger, irritability. We also have done research on genetic components. One of the theories is that the anger is really part of a depression. And in fact, people with high anger dysregulation in ADHD tend to be at risk not for bipolar, but for depression as they get older. And adults with ADHD who have a lot of anger, out of control anger and irritability, sometimes it is because they're becoming depressed. And so this is an issue that clinicians have to think about, and that those of us that struggle with this have to think about. This slide is simply illustrating by the solid arrows, the solid lines, that genetic liability for ADHD is related equally to ADHD and to emotional dysregulation, irritability, anger, tantrums, and exuberant sensation-seeking, overly risk-taking. Depression genetic liability, the dotted lines, is not related to ADHD or even anger in an ADHD population when ADHD genetic liability is taken into account of, and bipolar genetic liability is unassociated as well. So this is just genetic evidence that irritability is really part of ADHD. This anger dysregulation is really part of ADHD. It doesn't have to be part of an associated depression, even though sometimes it is. So what I want to do in the rest of the time here is the following. I want to do a little bit on the brain and its variations. And the theme here is going to be that ADHD is not a one-size-fits-all condition. There's important variations here among ADHD children and adults, and recognizing this is critical. It's the case both in the brain and in how things are experienced. We'll talk a little bit about best treatments, and I know some of the questions that have already started to come in are going to be about this. And I'm going to separate out children from adults here to some extent, because the answers in terms of what to do about tantrums and anger problems are a little different for children and adults. And part of this is obvious due to developmental changes. So first, this is a very complex slide from a recent and very fascinating study on ADHD in the brain. We know that ADHD has numerous brain correlates that show up on brain imaging studies, and there's a large number of meta-analyses now on this and large studies, and our group has contributed numerous studies in this area as well. When you look at people with ADHD, whether children or adults, as a group, you do see changes in the brain. What's important to recognize is those changes are fairly small. They're not diagnostic. You can't do a brain scan to diagnose ADHD or to diagnose ADHD with an anger problem unless there's a rare brain abnormality. By and large, this is not going to be visible on a brain scan. In fact, in this particular study, only 2% of individuals with ADHD had brain scans that actually matched, in terms of extreme deviation from normal, in a given brain structure, what the average group difference showed. So this just illustrates the wide variation among individuals in terms of brain scans with ADHD, which is why brain scans are still not diagnostic and will not be diagnostic until we have better subclassifications of ADHD. And one subclassification is going to be, I believe, ADHD with severe anger problems. So one way we've tried to address this in our research is to separate out ADHD individuals, here we've done this in children, by their emotional profile. And although this slide it may be difficult to see on these profiles, what it's illustrating is that there are different profiles for ADHD. And this slide did not display the way I intended, so I apologize. But what it's telling us is that there's a group of children with ADHD who clearly are different in that they have very high levels of anger and very low levels of what's called recovery or rebound back to baseline. So when they get angry, they can't get over it. They can't shake it off. They stay angry. And there's another group who are extremely risk-taking, sensation-seeking, active, and exuberant. They're also angry, but not as angry as the anger group. So all kinds of emotional dysregulation in ADHD seem to be accompanied by anger. So anger is a theme for people with ADHD much of the time, whether that's accompanied by a general feeling of negativity and negative mood and unhappiness and a sense of grouchiness, or whether it's accompanied by a sense of risk-taking and thrill-seeking, there's still a proneness to become angry readily. So here are the emotion profiles in children. We did a statistical procedure here, a mathematical procedure where we were able to separate out the kids. Each dot here represents a child, and each color represents a mood group. The first group here was the children with ADHD who did not have anything unusual about their emotional profile. They were inattentive, they were distracted, they were disorganized, but they did not have anger tantrums or other emotional dysregulation. This was about a third about 20%, actually about a fifth to a quarter of the group, maybe 20 to 25%. The second group was, we called them risk-taking, exuberant. They were very active and kind of unthinkingly going forward, but also had elevated anger, as I mentioned. And the third group was just really characterized by major tantrums that they would not bounce back from, but would stay angry for a long time and have these out-of-control tantrums. And we were then able to use this profile to clarify all this variety in the brain. So I mentioned how there's so much variety in brain scans that it's really hard to pick out an individual with ADHD. But if we do this based on these temperament profiles, we begin to make more sense of it. One way we've done this in this particular case is with brainwave recordings. This is a cap of electrodes that do not give electricity, but they detect electrical signals in the brain. And we see here that if we separate ADHD into people who are not the risk-taking group and those that are, we now see a dramatic difference in their brainwaves, even when, and without getting into details, these are brain regions that make sense in terms of emotion. Even without going any further, we can now begin to see that what before just looked like noise actually starts to make sense. We'll go a little further with this. One of the common sort of theories of ADHD is that it's characterized by a difference in the left and right brain electrical activities in the frontal cortex, and actually in the posterior cortex as well. There's a general finding in the literature that overactivity in the left frontal cortex is associated with negative emotions, and in the right with positive emotions. And they say symmetry of excessive activity on one side or the other was thought to be part of ADHD, but the literature was totally contradictory. It really wasn't making any sense until we divided up kids with ADHD based on their temperament profile. Now it all began to fall into place. We could see that for the subgroup that were very sensation-seeking, they were the ones that had a really sharp, if you look at the left-hand graph there, they had a very sharp increase in this brain asymmetry that is being looked for, and it was very, very clear-cut. And it just so happened this was also correlated with elevated genetic risk for ADHD on the right-hand graph. So this really clarifies and shows that there's brain validity to these emotion subgroups, and in this particular case, almost a biomarker for the sensation-seeking subgroup. Now, again, this is not yet ready for clinical diagnostics, but we're hopeful that it could get there in time. And so for that group, treatment would go, and this slide shows a different kind of brainwave, which is the millisecond by millisecond reaction to seeing a certain kind of emotion on a face. So this is a picture of a cheerful face. The individuals here were also shown faces that were angry, sad, and so on. And what we saw was that this particular emotional subgroup of ADHD had a very quick, automatic, unconscious reaction to emotion faces. That this reactivity was really what drove their overreaction to situations. Even before they were aware of their feelings, they were reacting. And you could see that on the electrical signals in the brain. And again, that group stood out, and you can see that on the graph on the right. So this tells us that if we're going to do some kind of neurofeedback or some kind of treatment to help with brainwaves in ADHD, we don't want to treat everybody with ADHD the same. We want to separate out what the profile is. And this particular group would be targeting this type of brain reactivity as opposed to some other aspect. We call this kind of bottom-up signaling. On the other hand, if you have the anger group, you need to add some measures to see what's going on. So here's a little task that we did. Here's an example of what would be shown to a child. They would see different children who are in happy or unhappy. Here's an image of an unhappy child, and we record their eye movements looking at this picture. And the instruction is, look up in the box on the left. Try not to look at the child's face who's unhappy or happy. And we then would track their eye movements. And for people with ADHD, they could not do it. They kept coming back to this unhappy face. They really were caught by the negative emotions and very aware of it. This did not happen to them for happy or neutral faces, only for negative, unhappy faces. They really were activated in their brain by seeing negative emotions. And you can see that they couldn't control it. They couldn't move their attention off of it. Their attention was caught. And this was the only group that experienced this. The other emotion groups and the other ADHD kids did not experience this. The top graph on the right shows this. You can see that the eye tracking accuracy went down the most for ADHD compared to non-ADHD kids, but only if they had the negative type. And that was also available in the brain here, where you can see different brain waves in the angry type of kids with ADHD. So we can see that there's different profiles of attention and top-down control for whether you have different types of emotion profiles in ADHD. So there is some brain validity to this experience. This is the general way that scientists think about how we regulate emotions. We have brain systems and behavioral systems related to those brain systems that cause us to approach potential reward. We think something good is going to happen and we want to come toward it. We feel subjectively, we feel excitement or hope, and we begin to approach. But if we're frustrated, we feel angry. And we get angry because our goal is frustrated and we react. On the other hand, we have another brain system that causes us to avoid negative things. We feel uncomfortable, anxious, scared, and we want to pull away from whatever is happening or going to happen in our mind or in reality. And if we get cornered or trapped by that, then we get angry again. And so you have anger both times. Both of those emotional senses are regulated or controlled, suppressed, or activated by our goals and intentions in our conscious mind, what's called top-down control. And there's a brain region called the anterior cingulate that's very important for this. And so there's brain circuits here that can be defined. And then there's a gating mechanism that I won't get into but it allows, when that gate breaks down, it allows that bottom-up emotion signaling to interrupt and overwhelm the top-down control and to break through there. Something is so important, so worrying, you've got to turn to it, and so it distracts your attention. And in ADHD, that happens a lot more often because of that gate and that top-down control connection being different. And I'm going to show a little bit about that here in a second. So going back to the brain again, these are just brain systems, and again, you all can get the slides. So I won't go through these in great detail. But what I want to point out here is that there are a handful of brain systems here that are involved particularly heavily, although many other systems are involved too. These systems are kind of paradigmatic of brain systems involved in emotional reactions and reactivity. And you can see this on the left here. This amygdala-insula connectivity is very, very important for danger signals and trauma signals, and trauma is an important part of all this for people with ADHD sometimes, and also things that are emotionally salient. So this circuit is very, very important in terms of its functioning, healthy functioning. If you're somebody who needs to manage appropriately potential signals of strong emotional importance and you want to not overreact, then this circuit is really going to come online to try to do something about that. If that circuit is weaker, then that's going to affect that. The second circuit here involves the ventral striatum, which is an area below the cortex, and it tracks reward. It's important for impulsivity. Both of these areas are supposed to be regulated then by these prefrontal areas that are on the right-hand side, including, again, the anterior cingulate cortex and other parts of the prefrontal cortex. So what we want to know is, are these circuits different in ADHD when you have a different emotional profile? Well, they are. So we took our emotional profiles, and first thing we noticed was that amygdala-insula circuit was not functioning normal, didn't have normal connectivity only in the children who had that angry tantrum profile. So again, we can see here that part of what's happening here is a change in brain connectivity and brain circuitry, that those circuits are not operating in the same way to regulate that anger when a signal shows up. And it's probably going to mean overgeneralizing of things, getting angry at things that actually wouldn't warrant that, but also not being able to control that anger when it's felt, feeling it and having it kind of run kind of as if the brake is not connected to the brake pads. It's also important to note that then the group that had the anger tantrums was the most at risk for future mood problems. Here you'll see just 2 years later, future clinical disorders and diagnoses were more than doubled in the irritable group compared to the other ADHD groups. This is really important clinical prediction, a much clearer clinical prediction than we ever would see with our regular clinical predictors like how severe is your ADHD and so on. So this tells us that, and most of these kids were getting anxiety disorders or depression later. And this is consistent with other literature. So this underscores the importance of understanding the element of anger dysregulation, in particular in ADHD. Even though it doesn't apply to everybody with ADHD, it's very important when it does. So what do we do about this? I want to then move to the final piece here, and I'm going to talk about this both in terms of what is standard kind of being learned about best treatments, and also about alternative and experimental things that are coming down the pike. And what's important to recognize is that for a long time, treatment studies of ADHD have only looked at ADHD symptoms. They haven't really been doing a very good job of looking at anger problems. And this is part of why it's a new area that needs research, and part of what disruptive mood dysregulation disorder did is it spurred research on this for people with ADHD. So I'm going to start with children and teens, and then I'll move on to teens and adults. This is a little bit of a complicated model, but it in one nice picture illustrates kind of the model of how children's anger reactivity gets out of hand and the different points at which it can be interrupted. So on the left, what you see is a tendency to over-perceive threat. This, again, is that amygdala-insula circuit where it's not properly regulated and threat is everywhere or overreacted to. It's a bigger deal is made out of it than it really deserves. And so this can be addressed by helping with cognitive therapy, helping the child to appreciate that something that's ambiguous isn't necessarily threatening. And we have research on children showing that ambiguous, and you do this with experiments. One of the interesting experiments is kids are in a line and a child actor comes by and he accidentally bumps into the kid in the line. And this is videotaped. And most kids just kind of, and they say, excuse me, and they move on. Most kids are just kind of like, hey, watch out. And they kind of forget about it as the kid walks away because they assume it's an accident. But kids with an anger problem, they get really mad and they view it as a deliberate provocation, and it really, really makes them upset. And so this is about attributions. But on the right-hand side, in the lower right there, would also have, in the upper right is inability to tolerate frustration, really being driven over the edge quickly by being frustrated. And so learning to tolerate frustration, another kind of potential counseling piece and something that parents have to help a child with. But also there's a parent piece. What tends to happen is that parents sometimes get angry in response to the child, and you end up in an anger contest with a child and parent both kind of having something like a tantrum. And that then leads to this getting worse and worse over time. And so it's an example of how parents can kind of get caught in a loop, a negative loop. And this can happen to anybody. This is in a way, this is average. I would not say that a parent that got in this loop was not a typical parent. I think it's sometimes the children's anger reaction is extremely provocative. And so part of the challenge and part of what's been successful in the treatment studies is really working with parents to react in a different way to the child's tantrums, and then combining that with some child counseling and some other things often can really help to tone this down over time, very successfully and encouragingly in some recent studies. So we really encourage this combination here. What about medication? Now, one of the interesting findings here is that ADHD medication does not really help very much with the anger problem a lot of the time. It does sometimes. I certainly have seen kids who went on a trial of Ritalin and their tantrum and explosiveness went away. It worked beautifully. But often it does not. It does not work as well as it does for symptoms of inattention as it does for most kids. And this is a recent study now looking at this in relation to children with severe tantrums and DMDD diagnosis and ADHD. And they were given a trial of stimulant medication. The MPH is methylphenidate, which is the generic for Ritalin. And then with the Ritalin or the methylphenidate, their ADHD symptoms got better, inattention got better, but anger and irritability did not. So for those kids, they were then put on a second medication, citalopram or Celexa. This is an SSRI. It's like Prozac or one of those serotonin reuptake inhibitors. And here, what the graph is showing is that there was a significant improvement. More kids benefited. A significant number of kids benefited from that second medication, and their irritability and tantrums really improved. So this is really a hopeful signal in this it's the first really controlled double-blind randomized trial on this. It just was published a couple of months ago from Alan Liebenluft's group out at NIMH. And it really demonstrates the first trial here that there probably is going to be some benefit to having to modify with a mood type of drug, but toward depression. And this fits with the idea that disruptive mood dysregulation disorder is anger, tantrum, and disruptive behavior, but it is related to a subclinical mood issue, even though they don't have clinical depression. I'm going to circle to both teens and adults related to alternative treatments, but for now I'm going to stick on adults and teens. What about standard treatment? Here, I want to say a few things about regulating emotions, because for adults, it really becomes much more of a deliberate work on ourselves about how do we regulate our emotions, rather than necessarily parents supporting us or even medication, although I'll say a word about medication in a minute. So first of all, there's two ways that emotions can be regulated. One is by interior, what do I do within myself? And the other is by outside help from others. So interior, there's a number of things that we do to regulate our emotions, and these are teachable. And so part of what's very, very helpful and very effective for adults is the counseling that works on teaching these coping skills. Anticipatory coping, I know I'm going to get angry next time this happens. What is my exit plan? What am I going to plan ahead of time to avoid that? Will I walk away? Will I make light of it? Will I tell myself something different? Or am I going to be able to avoid the whole situation by seeing it coming and going a different direction? Appraisals and self-talk. Maybe that was an accident. Maybe that car is tailgating me because they're trying to get to the emergency room. Maybe that car in front of me is going really slow because they just got a ticket. Maybe they're not doing this to be a jerk. And so doing that self-talk to keep our temper under control. The other is shifting attention, looking elsewhere. Yes, that political news is driving me crazy. I'm going to not look at that anymore. I'm going to go do something else. So really shifting attention, that's another way that we can regulate emotions internally. And then, of course, we have the old-fashioned biting our tongue, sheer willpower. This is pretty hard for people with ADHD. Willpower doesn't often work very well. And so unless it's planned, I'm going to use willpower. But often it's important to do other strategies to avoid having to use willpower. So this is only a subset of numerous coping strategies that can be developed and that are known that counselors will do a program with that are now being shown to help people with ADHD who are having trouble with their adult, I don't necessarily want to say tantrums, but it can feel like a tantrum, but out of control anger. But then there's also exterior supports, and these are often forgotten. For children, of course, exterior supports are very, very important to handling their emotions. With very young children, all you parents out there know that you spend a lot of your parenting time with your young children, helping them learn how to handle emotions, how to recognize emotions, how to cope with them, and so on, and probably teaching them some of these coping skills that I just mentioned. Loaning them, as it were, your own coping skills. And you also know that for older children, you try to do some of the same things, only use a little bit more sophisticated strategies for them. For adults, we can still benefit from other people helping us cope. Social support, other people talking to us, other people being there for us. So the importance of social support really should not be underestimated for you if you're struggling with ADHD and anger. And then, of course, there's a number of activities that can help us, getting out and exercising and so on. These are the coping skills that can be added into your self-care as you think about what's going to work for me versus what works for other people. So how do we practice these skills? How do we build resilience? There's the number of health practices we can do. There's research on meditation now, social supports, and so on. Let me say a quick word about each of these as I need to wrap up here in a second. First of all, for adults, here's what we know. Medication for ADHD has limited benefit it helps ADHD symptoms, but not emotion regulation problems. Behavioral counseling, cognitive behavioral therapy along the lines I just talked about, that is clear evidence. That's the way to go to get help here, sometimes with medication and adjunct. Meditation can help, but that research is limited, and nutrition is a new area. This is just a medication slide showing that ADHD medications are not that helpful for emotion problems in ADHD. This slide summarizes the results for different kinds of psychotherapies. Cognitive behavioral therapies work. Others, no. Cognitive training by itself without a behavioral practice component, no. Psychoeducation without practicing skills of coping, no. Mindfulness-based meditation, maybe, but the studies are low quality. So find a counselor who knows how to work with you on this type of therapy. There's alternatives that may work. I have some citations here in a slide that you can look at on your own related to some of these, particularly nutritional interventions that seem like they might be helpful. Omega-3 supplementation, we know, gives a small benefit to children and adults. These other neurofeedback hypnotherapy do not, so don't spend money on those. And then the take-home message here is that emotions is really part of ADHD. It's not, you're not alone. That finding basic skills for coping is key. Alternative treatments are emerging, but we have some standard treatments that actually can be helpful, but they're not standard ADHD treatments. They require modification. And different solutions are emerging. For kids, the keys are parents working directly around how they're reacting, and children learning coping skills, and then possibly combining a medication regime that adds the SSRI to the stimulant. And then there's also some evidence for omega-3s, supplementation of fish oil to help a little bit, although not by itself. Adults, it's a similar logic, but now you're working on yourself with a CBT-oriented psychotherapy, maybe a meditation class. Medication may be supportive somewhat, but it's not going to be usually enough. And then training on those coping skills with a professional. So I'm going to leave it there. I know we're going to probably have some questions. I want to thank you all for your interest, and we'll get to as many questions as we can. Thank you.
Thank you so much, Dr. Nigg. That was incredibly informative, and it's a lot to take in, but we have many, many questions. I will do my best to kind of represent what people are asking about. One big question that we're seeing is a better understanding of how the groups that you talk about, the angry, irritable versus the exuberant, risk-taking, how that intersects with or overlaps with our traditional ideas about hyperactive and inattentive subtypes. So is one subtype, more likely to exhibit the angry, irritable symptoms, for example?
Less than, I have a graph of that I should have included. Less than you would think. The what was traditionally called the combined type tends to split 50-50 into the two emotional dysregulated groups. So most of the combined type kids fit into one of the emotionally dysregulated groups. A few do not, but most do. And then the classic inattentive group is more likely to be in that relatively benign emotion group, to not have dramatic emotion dysregulation, but to be simply inattentive and disorganized. So it really comes out to dividing up the combined group. The pure hyperactive group really is almost an artifact of development, and I'm among the professionals who think it's very rare in after preschool. Most people with ADHD who are of hyperactive profile end up with a combined profile, but in our research, the hyperactive profile did fall into one of the two emotional dysregulated groups. So they don't line up very well, other than the inattentive group, usually not in the dysregulated groups.
Okay. And perhaps this is redundant, but there were a number of questions about whether you've done any research on gender differences. I guess typically we think of anger as perhaps more of a male behavior, and a number of questions here about girls and women with ADHD who exhibit more emotionality along the lines of crying, extreme reactions, not necessarily anger?
Yes, that's a very relevant question. We in the child sample, we didn't see big gender differences here, but I think in adults we would. There is a literature on showing that ADHD in women and girls does have different manifestations, and certainly emotions are handled differently in our culture by women and girls around anger. Classically, although that's starting to change among young people and teens, where we're seeing a lot more anger and aggression among girls than we've seen in the past. But I think that there is some truth in that. There's a tendency, kind of in the literature, for women with strong emotional reactivity or strong emotional sensitivity to end up with tears and fears and worries just as much as with anger, but still having the occasional rage attack. And for men to have kind of the reverse, the occasional tears and fears and probably quite a few worries, quite a bit of anxiety, but then the more prominent rage outbursts. So there is some gender difference in the rate of this, but I think both genders experience both of these just in varying rates.
Interesting. And we had a number of questions also about along these same lines. The topic of rejection sensitive dysphoria, of almost painful reaction to perceived or real rejection or criticism, and that does not necessarily come out as anger, but sometimes as self-criticism, and how that kind of fits into this model.
That's a great question. I mean, you really do see in ADHD kind of a general, I think of it as a general hypersensitivity to the environment across the board, hyper reactivity to the environment, responsivity to the environment, kind of for good and for ill in some ways, very passionate. And what then can happen is that social rejection, there can be a sense of fragility or brittleness at times, that social rejection really throws me over the edge more than it should. And I'm not sure why. And I feel bad about myself, both because I was rejected and because I feel bad about being rejected. And so it becomes a circle in the mind. And I think this has to do with that. It is related in terms of difficulty coping with emotion, and difficulty with kind of those brain circuits that kind of stabilize emotions. It's almost like the ship's rudder doesn't run deep enough in the water to keep the ship from getting buffeted by the winds. Mm-hmm. So a social rejection is a major trigger for feeling depressed and feeling down for anybody, and for people who do become majorly depressed, often the trigger is a loss, often a social rejection, especially for teens. For adults, it can be a career failure as well as a social rejection. And so for people with ADHD, that social rejection is going to be felt twice as much, and there's going to be more difficulty handling it because it's a powerful emotional signal.
Okay. So that would fall then more into the angry, irritable camp, I suppose.
No, it could be either camp. If you think of the dysregulation as difficulty managing emotions, anger for sure, mm-hmm. but also all emotions, just in more tendency toward negative emotions for the angry, irritable group. So yes, that group tends toward negative emotions. So they might feel rejected more sensitively. Mm-hmm. But I think that difficulty coping, and even in the exuberant kids, and probably the exuberant adults, though we haven't formally studied them in the same way, you will see that ability to just flip right away from exuberant to crushed when there's a rejection or a disappointment. So there is that kind of windblown sense of reacting.
Mm-hmm. Mm-hmm. Okay. And of course, we're getting a lot of feedback from people who are seeing perhaps these symptoms, specifically anger and emotional reactivity in their children mm-hmm. more than ever. Mm-hmm. And I assume that it's not a coincidence, given the fact that people have been on quarantine now for 4 months. Have you seen this? Has there been any study on kind of the environmental factors? You mentioned trauma kind of briefly, and I wonder if these times could be classified as traumatic and of having an exacerbating effect.
There's certainly a high pressure on people right now. It probably rises to the level of trauma for some individuals, but I think for everybody, it's a lot of stress, and for people with ADHD, that's something that is always hard to cope with. We do have data, not our lab particularly, but I have read data showing that depression and anger are going up in the homes around the country right now. Not just in our country, but everywhere that there's social restrictions going on, and kids aren't in school, aren't able to go to their usual summer activities. Parents have restrictions on their activities. Everybody's in the house together, so tempers are running thin. And this is a tremendous stress and a tremendous reality. And we are seeing spikes in suicidality and depression, as well as in anger and aggression and within home violence even. So in homes that are unfortunate enough to actually have violence between spouses and kids, that's increasing now. Abuse is increasing. So it is a very, very tough time. And I think that it's very, very understandable and true that a lot of parents are seeing more anger in their kids as a sign of the difficulty coping. So I almost think at this point you can see the anger as a symptom of, I can't cope, I'm overwhelmed. And this partly reflects that the society as a whole is being overwhelmed by stressors right now. We have the combined kind of triple whammy of that you often hear talked about now, of the disease and the shutdown and the social isolation, the economic dislocation that's touching almost everyone in some form or another, salary cuts or threats of those, or job losses or layoffs or the threat of those. And needless to say, a very tense political climate that's troubles a lot of people and creates a climate of stress, I think, that is felt even and as a parent, if I feel it even subliminally, my kid's going to pick it up. Kids they have a radar for our emotions, and they mirror our emotions unwittingly. And so one of the things that I tell myself is, when my child, or for that matter, my dog is losing it at exactly the wrong moment. Why are they doing it now when I'm so stressed? I realize, well, that's why they're doing it now, because I'm so stressed. And so it's a reaction to my own stress. And so part of the task for parents right now is really to manage our own stress level and recognize that we need to get on top of our own stress so our kids can not be picking up on that, and then their stress will go down. And in addition to giving them the coping skills and coping strategies that they need to handle being overwhelmed. So I've encouraged parents to recognize that kids are getting angry now, not as a deliberate way to provoke us, but as a way to tell us they're overwhelmed and they need help coping.
Mm-hmm. And you mentioned in your slide about treatment for children, both basically training for parents as well as counseling for children. Yes. So yes. Part of it is the parent training.
Yes, absolutely. Part of it's that parent learning not to be reactive ourselves to our child when they really seem to be provoking us, because we get into a negative cycle then. And that ends up, research shows that over time that ends up hurting the long-term path for the child. And so to divert that, we learn not to be non-reactive and to do something else. And that partly involves those anticipatory coping strategies. I know the child's going to get angry at some point. I know when they do, it's going to bother me. What is my plan? What am I going to do? So I'm not just reacting, but I have a plan ahead of time to what to do. So that's the kind of skills that get talked about with the counselors. And then the child gets the same coaching. And that counseling is available now. The remote counseling is up and running. All the insurers have all changed their reimbursement strategies. Everybody can get counseling virtually now that needs it. I'm not saying that it's always open, but it's happening. So it's worth seeking if you need it.
Okay. There were quite a few treatment questions, but one that seemed particularly important to address. Have you found any correlation between stimulant use and sort of exacerbation of these symptoms of anger and irritability?
It happens very clearly when the stimulants are overdosed. Mm-hmm. So we have seen cases where the stimulants push the child into constant major tantrums. And the problem was that the dose was too high. And so when we simply had our psychiatrist cut that dose in half, everything balanced out. So yes, the stimulants can definitely exacerbate it. They can drive it. Sometimes that's a negative reaction to the stimulant, but I think it also can be an overdose. This is anecdotal, but I would say yes in that respect. So definitely if the stimulants are going, if you think it's getting worse despite the stimulants, definitely look at that dosage or a different stimulant or starting over, or get a second opinion, because the doses often need to be started lower and build up gradually.
Okay. And I hope we can squeeze in some more here. There were a number of questions about differentiating between bipolar disorder and ADHD with this, strong emotionality factored in. And you did talk a bit about how they're different, but I wonder if you could review some of the clear markers that perhaps your bipolar mood disorder diagnosis is not accurate.
Yeah. So for if the child is having severe tantrums, the first thing is it doesn't mean anything about bipolar. So there has to be other symptoms before we think bipolar might be present. For bipolar, the hallmark is really this what we call elation or elevated mood, where for an adult, it is really being on top of the world. I feel like I could conquer the world. And, I have so much energy. I'm sleeping 3 hours a night and feeling fantastic. So it's really this burst of energy that's sustained for days, if not weeks, accompanied by tremendous enthusiasm, a tremendous high, and in actual mania in adults by delusions of grandeur. I actually think I can stop this virus myself. Here's what I'm going to go do. And so I've got an idea for a company. I'm confident. I'm so confident I'm going to take my life savings, withdraw all my retirement funds. I'm going to invest them in my new company idea, because my new stock idea or my new investment, because I have solved this. So you get these elated ideas that are totally unrealistic and reckless spending. Now, for children, what you'll see is an elevated mood that's clearly not normal for this child, where they are feeling so expansive and so great and on top of the world, and not needing as much sleep and having tremendous energy. For an ADHD child who's already hyperactive, it's really hard to tell the difference if they're moving into an overenergetic mania. But you do notice this very, very unusual elevated mood, not just for a few hours, but for at least 48 hours straight. It's like, this is really a different kid. Something is happening. It's a change from baseline that's striking, and it's not momentary.
Okay. And that is to be differentiated from, as you said, the dysregulated mood disorder.
Exactly. That's different than a kid who's in a bad mood all the time or has a tantrum that lasts all afternoon. That's not mania. But if they are in a state of elation, if that tantrum is combined by the fact that an unrealistic elation, then maybe, and lack of need for sleep and a burst of energy, and that goes on for a few days, then maybe that is also mania. But that the irritability then would just be an additional symptom, not the main symptom. Okay.
And because DMDD was we got a lot of questions on that as well. Do you have a sense for how young a child may be diagnosed with dysregulated mood disorder, and conversely, how does it persist into adulthood?
6 is the youngest that we would diagnose it. We don't have any data to suggest validity before age 6, because tantrums are so common in preschoolers and toddlers, obviously. Mm-hmm. So it doesn't mean that it can't be present, but it's not able to be distinguished in any reliable way from normal difficulties of development. And so that's really a difficult clinical call, whether we're just going through a rough patch or whether this is really something more serious until we're 6 years old. And yes, it can persist, but in adults, it's going to take a different form. You could be diagnosed with DMDD, but you're more likely to be starting to be diagnosed with either a mood problem or a personality problem if you're really carrying these chronic tantrums, or it's just ADHD now, with severe tantrums. But the DMDD diagnosis could still be used. The main issue is that formally it can still be used. It just hasn't been studied very well in adults. And so it's really kind of a frontier to say, is it valid enough that we should be using it, and that it's going to lead to different treatment outcomes like it seems to be doing for kids?
Mm. This is all so fascinating. I have to tell you, we received 566 questions. So I touched on just a fraction of them.
Wow.
And I would venture to say there is more than enough here for another webinar. So we will get working on that. But for the time being, thank you so much, Dr. Nigg, for this presentation. It was very illuminating. I have a notebook full of scrawled notes here, and I'm sure everyone else does as well. So thank you so much for that.
My pleasure. Thanks for having me.
And I will just take a moment to thank our audience for joining us today and to encourage you to come back. We have webinars every week. And in fact, we have another one this week on Thursday at 1:00 Eastern. We'll have a live webinar with Dr. Sharon Celine on a somewhat related topic, Ready, Set, Pivot, how to prepare your kids and yourself for an unfamiliar school year. Lots of anger and emotional feelings about that. Please check attitudemag.com/webinars for more information. And I think that will wrap it up for today. Thank you again, Dr. Nigg, and thanks to everyone for joining us on this very important topic.
You're welcome. Thank you.
For more Attitude podcasts and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com. That's ADDITUDEMAG.com. That's ADDITUDEMAG.com.